one. Okay. Hi, my name is Stephen Blank. I'm the editor and publisher of Blank Slate Media, and I would like to welcome everyone to a very timely discussion on the mental health crisis in the United States. Let me start by introducing our panel, beginning with Dr. Liat Jarkon, the director of the Center of Behavioral Health and an assistant professor in the Department of Family Medicine at the New York Institute of Technology. Andrew Malikoff, editor-in-chief of Social Work with Groups and the former CEO of North Shore Child and Family Guidance. And Dr. Jeffrey Reynolds, the president and CEO of the Family and Children's Association. Before we begin, I'd like to thank Northwell Health for sponsoring this event and invite those in our audience to submit their questions to me online to ask our guests. Let me start and on the issue, and I guess all three of our guests can have a discussion here and address this. The Surgeon General recently, in an unusual warning in December, said that young people are facing devastating mental health effects as a result of the challenges experienced by their generation. So let me kick that off. We'll start off with Liat and let you address what is happening with kids.
That's a very, it's a broad question, Steve, but I will tell you that Dr. Murthy, the Surgeon General, did report in December that the levels of mental health difficulties affecting our children have risen astronomical numbers. We started having a mental health crisis, if you will, way before the pandemic. The numbers are different depending on where you look, but approximately 2009, 2010, a lot of the mental health community started saying, we have to be careful. There's something going on here. The numbers are surging and we need to have a little bit more ideas as to how to help our kids. What's happened since the pandemic, Steve, is that the numbers have skyrocketed. It has catapulted the number of people, children, adults, seniors who are dealing with anxiety, depression, domestic violence, substance abuse issues. And that's what he was referring to. We can no longer just take a look and take a look at it from the outside, but we need to do something about it.
So what are the things that are impacting children? What are the drivers? COVID obviously is a factor, but that was not the only one. The Wall Street Journal recently ran a story discussing the toxic effect of Instagram on teenage girls, and worse, that Facebook, the owner of Instagram, knows all about it, but hasn't really addressed that. But what are the factors that why children were having difficulty before COVID and how it's happening now?
I think the reason that Instagram and other media are so attractive to young people is that it's immediate gratification. I think with the pandemic, what happened, there was more isolation. They felt bored and lonely and frustrated. Their entire lives were turned upside down, with schools going from in-person to remote and hybrid patterns. There was an article recently, I believe it was today, that the American Psychiatric Association put out saying that the fact that their classrooms were turned more towards remote learning increased behavioral issues in children. So yes, they were there prior to the pandemic, but with the increased isolation and changes, they were sitting at home bored and they would look more on social media. And so it was exacerbating the already existing situation.
Jeff, what are you seeing at Family and Child associates.
Sure. You could just call it FCA. That'd probably be easier and save us some time. So we run a very large children's mental health program. I would say we've experienced firsthand the distress that families are experiencing here on Long Island, and families here on Long Island are reflective of families, I think, across the United States. Liat made a number of good points in terms of the uncertainty that kids are feeling. There's an old adage, and for those who are parents, they'll understand this: you're only as happy as your least happy child. But we also know that kids look to their parents for support and guidance and certainty. And if adults are having a hard time coping, imagine how difficult it is for a 12 to 15-year-old kid or even younger who's navigating a whole bunch of changes all at the same time. Our waiting lists for children's mental health services have grown in a very significant way. We're working hard to whittle those down. But Stephen, at the same time, there's been a COVID crisis. There's a workforce crisis. And I'm having a hard time filling positions at FCA. I've had folks, social workers, well-trained social workers who, because of the stress in their own lives, merging with the professional stress, have said, I'm going to go work at Walmart over the course of the holiday season. They pay $20 an hour. I'm only making $19 an hour as a social worker, and Walmart is a whole lot less stressful. And so those waiting lists are growing at organizations across Long Island, quite frankly, because they've been chronically underfunded for an entire generation. And even if you try to call an adolescent psychiatrist at this point in time, I have families coming back to us saying, you recommended a psychiatrist. I called today and they booked me into an appointment in April. Well, things can change dramatically between now and April, particularly with a young person. So we're really facing epidemic levels of stress and anxiety in our young people. It doesn't always play itself out in completed or attempted suicides, but I think for the next 10 years, our young people and families are going to be experiencing and dealing with the consequences of COVID long after we find a way to eradicate the virus. The psychological consequences are going to persist. And again, I think the number one thing here for young people is the uncertainty. Young people thrive on certainty. That's one of the reasons why periods are so defined in schools, right? The bell rings, you get up from one place, you go to another place at the same time every day. Young people appreciate that certainty. It takes the guesswork out of things. And a lot of that was thrown up in the air during COVID. And while we all like to say we're almost back to normal, I heard Brene Brown, who's a best-selling author and a podcaster, describe it this way, and that it's almost as if we have escaped this pen that's surrounded by barbed wire, but as we jumped over the fence, our shirt caught on the back of the barbed wire and we're still being pulled back in. If we all feel that as adults, imagine again that you're a kid.
Now, Andy, I've also seen there's a lot of discussion about if you're growing up now, what you've gone through. And it's not just COVID, it's January 6th, where there was an attack on the Capitol. If you're, 15, it's the after effects of 2008 and the meltdown and what that did to families in terms of losing jobs and losing income. Can you discuss kind of the lead up to COVID, where it kind of started earlier?
Yeah, I think to go back to your introduction about the Surgeon General, in his report, and listeners, viewers can find it online. It's a 53-page report. And one of the things that he emphasizes is something known as adverse childhood experiences, or ACEs. And these are associated with every major chronic illness and social problem in the United States. And what adverse childhood experiences are the risk factors that go back to early childhood up to wherever a child is at this point in their development. And they could include things such as homelessness, poverty, interpersonal violence in the family, whether experiencing it or being a witness to that violence, loss, which is a major factor in addition to uncertainty with the pandemic. Loss is critical. And I'm not just talking about death and dying, loss of routine, loss of structure, many of the things that kids have been accustomed to, whether it's in school or in the community, all of a sudden were lost in their life. Separation, divorce, death. So the accumulation of risk factors are a sign as to how far at risk a child is for developing poor outcomes in their life. To mitigate against risk are protective factors, which are, for example, a good relationship with an adult or a peer group, or school connectedness, for that matter, being, connected to teachers and guidance counselors and other folks within the school community. So one of the things that the Surgeon General really emphasized was screening for ACEs, screening for adverse childhood experiences. And this is something that mental health clinics, schools, individual pediatricians can do very easily. It's a very simple and easy screening tool, which can give a practitioner or a teacher or somebody that's working guidance counselor with a child a sense as to what their risks are and whether or not further screening and possibly mental health treatment is indicated. And so one of the things that I would certainly encourage, and I think would be easy to do, would be for all of the above, pediatricians, school personnel, mental health clinics, even private practitioners for that matter, to do that simple screening, which looks at a child's earlier years and gets a sense of what kind of risk factors they've had. And it doesn't only mean the accumulation of a number of different risks, whether it's homeless, poverty, violence, separation, loss, et cetera. It's also a question of how meaningful and intense a particular risk factor might be in their lives and what kind of an impact, and whether or not there's something to mitigate against that in their lives. So that's a universal area that people should be taking a close look at. And, as we face these different risks that you and different crises that you mentioned, 9/11 and, Superstorm Sandy, and now certainly the pandemic, which is the most universally insidious thing that we've faced in our lifetimes. Taking a look back is really critical.
Let me step back to social media, because a lot of discussion, we're talking about the impact. And I guess this is a question. Number one, Facebook for us, I guess older folks now for Facebook. These days it's Instagram when you're younger. But what is the impact of social media? And I'll let you start off, Leon, with this, and we'll go around the horn here. But the impact of social media, and what should parents do or try to do? Can they do anything to stop it? Because when I was growing up, that was not an issue that my parents had faced, is to deal with that. And there's all these voices coming in. So can you comment on social media, and what should parents be recommending? What should they be doing, if anything, to deal with what's out there?
Steve, I definitely can comment on it, and I think that it's it's very, very complicated, because the reason social media is so popular amongst kids is that they are sometimes bored and alone. The parents, back to what Jeff was saying earlier, the parents are stressed. And if the parents are stressed, they may not be interacting with their kids like we used to do way back when there was no social media. So it has to start at the top. So we have to address the fact that adults and parents in the world right now are all stressed out based on the pandemic alone, right? And there's this platform, there's this social media that your children just get involved with, and there's nothing else to do. It's almost like many years ago, parents would have to limit how much TV time the kids had, right? And now it's social media time. It's almost like a babysitter if parents are, themselves preoccupied with what's going on. Let's face it, they've lost jobs. Jeff was pointing out that professional people are leaving their positions because they're so stressed out that they're finding other work. So what we can do about social media is try to engage more with our children, keep them occupied in hobbies and things that are more beneficial to their mental health and their growth. The other thing, the reason that children are suffering when they're spending too much time on social media is actually studies have shown that they get depressed and anxious because they're comparing themselves to everybody else. And this is not just children, this is for adults as well. And you just can't measure up. A lot of people, when they go on social media, put down, nice pictures on vacation or things they're doing and so on. And it seems like they're having such a great time. And here I am suffering, I lost my job, or I don't have enough money, or so on, and it's that kind of, keeping up with the Joneses, which the children are doing. And also, I think a lot of adults are showing that. So I think in a nutshell, if we spend more time with our children, engaging them in things that are family oriented, having like a family game night, things like that, they'll have less time to spend on social media and sort of being isolated. I think that's a big thing, family time.
Is there, you can't, one of our attendees pointed out, you can't shelter kids, that it's out there, but it's this influx of information that's coming. Jeff, in terms of the issues of what you're saying, is there any way to sort of filter that or do that? I mean, if I guess there's a question, it came up, I saw this education where they're talking about history, and critical race theory has been raised as this issue out there, that they don't want the information coming to them. And I remarked in an editorial, there's not a lot that the parents can do with these kids if they're on social media. Are you going to take, how far are you going to go to protect people? Are you going to take their iPhones away from them and not let them happen? So, Jeff, when you're confronted with this, what is, and you're talking about family issues, what are you telling parents in terms of how to deal with social media and their kids?
So Liat gave a really good piece of advice, and that is spend time with your kids. I would take it a step further, and I spend a fair amount of time telling parents to act like parents and stop acting like your kid's friend. One of the issues, if you look at TikTok, one of the single largest growing populations on TikTok is women between the ages of 30 and 50, right? So if mom is in the kitchen making TikToks, right, it's very hard to say to your 15-year-old daughter not to be making TikToks. And so part of it is that kids learn from us. They don't necessarily listen to us, but they certainly learn from us. And if every dinner table conversation is punctuated with picking up the phone and looking at Facebook, or picking up the phone and looking at Instagram, if every time you go on a trip, you need to snap a million pictures that you immediately post onto Twitter, you're missing out on life and you're missing out on experiences. And so for parents, I say, model really good behavior. Secondly, stop acting like their friend and act like a parent, which means having the ability to say, it is 9 o'clock. The phone closes down at 9 o'clock. And if it doesn't shut down, I take it. Right. And that means it should shut down for everybody. It shouldn't be, you take the phone away and then as a couple, you're on the phone the entire time. And so enforce some rules, set up some guidelines, set up some structure. The other thing that's really important is that our kids are seeing things much earlier on social media than ever before. They're seeing issues related to race, issues related to sexual orientation. They're witnessing their peers being bullied. They're witnessing folks make suicidal gestures online. They're seeing a whole bunch of stuff that we didn't necessarily see as kids. At the same time you're cracking down on their cell phone use, it's really important to say to them, if you see something that makes you uncomfortable or you think puts somebody else at danger, it's really important that you come to me and that you talk to me about it. So at the same time you're applying the pressure and modeling good behaviors, You want to make sure you keep those lines of communication open because kids see and hear a lot of things and they need an adult to process that with. That should be you as the parent, not someone else.
Andy, you wrote a column for us. One of your best columns. One of the ones that I enjoyed the most about your childhood and dealing with during World War II and Nazis and folks like that. One of the things that I wondered, how does we have not gone through, and in other countries, people do. We're not in war. No one in this country has endured war. You haven't gone through what happened in World War II. We haven't done that. So how does this, number one, what was the impact on the parents? Is this something that can be sort of passed down in terms of people and how they react and how that formed, how children were formed back during in times of crisis like war and World War II?
I'm not quite sure what you're asking me, Steve.
I guess the impact for the adult population of having all these people who went through the trauma of war, the Holocaust, World War II, the bombing of places, countries in Vietnam that have had that. What's the impact on kids?
Well, I think certainly, the baggage, if you will, that you carry along with you is something that influences how you're going to relate to your children. And I think the kind of trauma that you're describing for parents that have maybe lived through war. Of course, there's no parents right now that have lived through World War II. There are some grandparents that probably lived through the Vietnam War. Certainly whatever you've experienced in your past is going to have some influence as to how you relate to your children.
I'm talking about what's the impact on the children where where they've lived through that and what happens to them.
Oh, children that have lived through those kind of experiences?
Exactly.
I see. Okay, I understand. Well, I think that we've all become familiar with the term post-traumatic stress disorder. And toxic stress is another term that has become more and more available, let's say, to the public. And so for children that have gone through those kinds of experiences, the toxic stress and the trauma that they've experienced, if they don't get some help in terms of being able to express themselves, is something that's going to influence their lives. It's going to influence their health. It could lead to all kinds of issues later on, whether it's heart disease or diabetes, which are certainly, some of the health outcomes that people that have gone through these kind of traumatic experiences have. It'll affect their relationships. It, can lead to flashbacks, certainly to anxiety and depression. So to what extent, for example, the COVID-19 experience has induced trauma in kids, trauma and loss for that matter, is yet to be seen, and it depends on the individual. But certainly death and dying is something that has been more pervasive over the last 2 years since the onset of the pandemic. And you can add to that the years and years of overdose losses that families have experienced. And, for kids, there's like 140,000 kids in this country that have lost either a primary or a secondary caregiver. And, globally, more kids have become orphaned as a result of the pandemic. It's a pandemic in and of itself. So there's a certain significant degree of trauma and loss that young people are struggling with now. And so, there needs to be a way to assess the kids that are having these kinds of profound struggles, and then to be able to refer them to get the help that they need, which is another matter that I won't get into right now. But the difficulty in terms of getting the help that's needed once you're identified as someone who's experienced anxiety, depression, trauma, or loss is a real puzzle that many families face today.
Who's supposed to be doing this? I guess this is the question, that there should be these things. Is this the responsibility of schools? Is this something that the county health department should do at Leah? Why don't you answer, who should be, obviously their North Shore Child Guidance is there for families to take it. FCA is a place that is doing it, but whose responsibility is it to be sort of on the front lines and diagnosing that and or referring people for that?
I think that it's the responsibility of several different factions. Most people who have psychiatric issues, whether it's kids or adults, don't typically go to a mental health person first. They don't go to a psychiatrist, psychologist, or counselor. They end up, the frontline people are the pediatricians, the family practitioners, and so forth. And one of the things that's happening now, Steve, is that there's this new effort called collaborative psychiatry. It's kind of a new frontier in mental health, something I'm going to be talking about in the spring at one of the events we're holding. But essentially what has to happen, and I think both the Surgeon General and many other, the American Academy of Child and Adolescent Psychiatry, the American Academy of Pediatrics have talked about, is to expedite allowing and helping primary care physicians, pediatricians, and schools be centers where they are trained professionally to be able to screen kids for issues, whether it's depression, anxiety, behavioral issues, suicidal potential, and to offer services there, because there are not enough mental health workers right now, as Jeff was alluding to earlier, that are able to take on this type of responsibility. So the collaborative care model and the teamwork is really what it's all about. Jeff also mentioned earlier, and I think so did that Andrew, about the fact that where do you get this help? You can refer someone to a psychiatrist or a child psychiatrist or a therapist, but I know even in our own clinic, there are 6 months wait, and it's very, very upsetting. And the way to counter that is to have other people also be able to chime in and help out. And what's going to happen is eventually, I'm in a medical school, we're training even the students starting right now in terms of mental health. It's going to be integrated across all specialties. So that's the way. And whose responsibility it is the responsibility of parents to be aware of what's happening with their children, to ask questions, not to be shy to say to them, have you ever thought about hurting yourself? Are you having issues with school or so on? It's the responsibility of teachers who see the students all day long. They're teaching them, but they're with them for 7-8 hours a day to see and point out and bring it to the attention of the school counselors, the parents, and so on. Pediatricians screen routinely now, as we were talking about earlier. And so I think that's it. I did want to say one thing, if it's okay, just dovetailing off of Andrew's comment about, what's happening, with all the losses. There is a phenomenon called collective trauma. And it's a phenomenon where a large community, and right now it's the world, faces one very, very deeply distressing event, and they are relating to it. It affects everybody, has like a shared impact. And they looked at war situations, which you were referring to before, Israel in particular, who has been in war, for many, many years, and how they've allowed their children and their citizens in general, how they've been most successful in handling that kind of atrocity and catastrophic situation. And their insight was that if you have a community that's thinking the same way, then it's easier to do. And unfortunately, in our society right now, there's such a divisiveness, whether it's political and other ways. There is a faction of people who are extremely conservative and saying, this is a huge issue, the pandemic, wear your masks, get your vaccines, and so on. There's a faction who says this is ridiculous. It's impinging on our rights. We don't want to wear masks. We don't want to, get vaccines. And those two are fighting against each other. And so the way it's affecting children, I think I'm answering your question a little bit of a roundabout way, is that they are seeing that there's not solidarity. And it's very, very upsetting. And adults themselves have been so aggressive over the last couple of years. The airline industry has reported like a 5-time increase in how many reports they have of unruly people in planes fighting, the increased aggression against teachers, against school districts. It's just going out of control. And the reason is because it's collective trauma. People are internalizing all of this anger and they're looking for ways to release it. And it's coming about in random situations. You hear about it in storefronts. People are getting into fights because they're asked to put a mask on when they go into a restaurant. This is what's happening. It's everybody's responsibility, to answer your question, Steve, to make sure that you are realizing you're role modeling not only for your children, but for your neighbors and your family. And we all have to be in this together. And unfortunately, there's not one common thought. There's two different schools of thought in terms of even the pandemic.
Jeff, you had mentioned about the underfunding of mental health earlier.
Yeah.
Can you describe that? I mean, I know some money was made available through COVID relief.
Yeah.
But in addressing that, but where are we in terms of funding programs that would help address this, whether it's the schools or getting additional people who are trained to deal with these problems?
Yeah, Steve, I think, in a lot of regards, COVID has upended our lives. It's also, I think, raised the profile of mental health issues because, quite frankly, it's now more relatable for most folks. If you ask the average person who considers themselves to be well-adjusted, whether they have suffered anxiety or depression over the course of the past 18 months, I think nearly everybody would say yes. And if they say no, they're probably either detached from reality or not telling the truth. I think, at the same time, there has been an awareness on the part of government that we need to do something about this. And so, for example, the governor's budget released just yesterday does contain significant increases, both for school funding for these types of programs, as well as for community-based organizations that are on the front lines serving communities and individuals, particularly those who are lower income. At the same time, and so there is a bright spot on the horizon. I don't think we can solve everything with money, but getting services to folks who need them, meaning kids and families, I think is absolutely critical, and it's been a long time in coming. There's a commenter in the chat who mentioned the issue of insurance coverage, and that's been an ongoing issue in terms of being able to access care. And so if you're not poor enough to qualify for some services, you're not rich enough to finance your own care, and you poured tens of thousands of dollars into insurance premiums, only to find out your insurer refuses to cover conditions above the neck in the same way they cover other conditions. That's something that was supposed to be addressed through several pieces of legislation over the course of the past 10 years, but that remains a practice today. And many of the major insurers believe, and sometimes rightly so, that person will try to access care for themselves or for their kid, will run into a roadblock, and then because of the ambivalence that sometimes goes along with a substance use disorder or a mental health condition, those people will just go away. In a lot of cases, quite frankly, they complete suicides or they die of overdoses before they're ever able to access treatment. So the public funding is really important, but so is the insurance coverage for these conditions and making sure that insurance companies are providing the reimbursement for the care that we hope to make more available in the community. So yes, it's getting better. Yes, there are dollars, but I think we still have a long way to go. The final point that I want to make, Steve, you asked about kind of war-torn communities, and we talked about the fact that our kids haven't lived through a war, but we've also never had a point in time where our kids go to school worried about being shot. That's never occurred before in the history of civilization, where our kids are walking through the door only to see police cars in front and being told how to shield themselves from bullets. And while we used to get ready for air raids and hide under our desks as just a routine kind of thing, the level of concern among students has risen exponentially. My kids have had school canceled a number of times already this year because of school-based threats. We know that there's a hierarchy of needs, and safety and security comes first. How are kids going to learn if they're sitting at a desk worried about being shot? The short answer is they don't. And the long answer is they don't learn, but that stress also accumulates over time. Match that stress up with losing a grandparent, maybe to COVID, losing a sibling, perhaps to a heroin overdose, having your parents divorcing as a result of all the financial stress and everything else caused by COVID. And you have kids that are walking around with not only heavy backpacks, but a lot of emotional stress on their shoulders.
Andy, let's move to, and I guess part of this, and we touched upon this, is also the fact that we're having a epidemic of alcohol and drug addiction. The CDC reported that 100,000 people have died of drug overdose deaths in the United States in the 12-month period ending in April 2021, an increase of 30%. Now, that was an issue, and drug addiction was something that has been going on for years. But Andy, can you discuss that, of what the status is in terms of alcohol and drug addiction and the impact that has, where it is, how serious it is, and where we are in combating that?
Well, I am going to defer to Jeff with that question, but before I pass it along to him, just would like to comment a little bit further on the issue of insurance companies, because it's
Figured you would.
it's not only insurance companies and the government are not living up to their responsibility to provide people with quality, affordable, and timely mental health and addictions care, even though they're legally bound to. And Jeff referred to some legislation. The landmark legislation was the 2008 Mental Health Parity and Addiction Equity Act, which required that insurance providers of mental health and addiction care provide their services at the equal level of physical health care in terms of reimbursement to providers and accessibility and so forth. And one of the things that they require is that each insurance company have an adequate network of care. So when Leah referred to the issue earlier, the fact that there's not enough providers out there, there's not enough providers out there that will see the people that need help, which is more the issue. And the insurance companies are mandated to see the people, the insurance companies are mandated to have a list of providers, a network of providers that will see whoever it is that calls them for the help that they need. And the fact is, and we did some research on this when I was with the Guidance Center a few years ago, we surveyed about 650 people across Long Island, and about 40% of them said that they could not find a provider who was affordable to them, that they were turned away by their insurance company. And the New York State government is responsible for overseeing this and for monitoring it and regulating it. And they've really done a miserable job of that. So between the insurance company and government, they're really preventing people from getting the help that they need unless they're very wealthy, or unless they're either very poor or they qualify by virtue of the degree of disability for Medicaid. all those people that Jeff referred to in between are the ones that are losing out. And, if you don't have access to care in a timely way, that's the same as being denied care. So I'm going to, again, defer to Jeff with your question about drug and alcohol, because that's an area that he is most expert at.
Jeff, you got a big buildup here, so.
Sure. Yeah.
No pressure. No pressure.
So thank you, Andy. No, it's pretty easy. So, this region, meaning Nassau and Suffolk, was hit hard by the opioid crisis. 10, 15 years ago, we made national news after a series of overdoses among young high school students here. And over time, there was a response to that. I think a pretty thoughtful and multi-pronged response to it. And, we were able to bring those numbers down from their height in 2016, and we're making great progress in reducing overdoses. Frankly, I believe that one overdose is too many. They're all preventable. Whether or not substance use is preventable, overdoses certainly are. And we had made some really, really impressive headway, and then COVID hit. And that all fell apart. It fell apart for a number of reasons. One being just the huge amount of stress and anxiety that people were feeling. One of the things that we always talked about was when we talked about opioids work well for addressing pain. That's why people take them. And they work well on pain, whether that's physical pain or psychological pain. Same thing goes for heroin. It's the cheaper alternative. So during COVID, we saw a shift away from law enforcement cracking down on opioids and heroin. We saw a change in the supply because the local ports of entry were closed. Most of the primary care visits were canceled. And so folks had a real hard time accessing prescription drugs that they had been misusing for an extended period of time. They began using drugs that were unsafe, things like fentanyl, and we immediately saw a spike in overdoses. And while heroin gets all of the attention, and it should, given the overdose numbers, and you mentioned the cumulative numbers to date, I would quickly remind everyone that alcohol kills more people than heroin, fentanyl, and all of the drugs combined, still to this day. And if you think about COVID, one of the few essential services that was left in place was alcohol sales. And in fact, restaurants were allowed to bundle it up, package it up, put it in a 55-gallon drum, put it in the back of your trunk, and you drove off back home. At the same time, you're isolated, not having to go to work, feeling anxious and stressed and everything else. And we wonder why alcohol consumption increased 35% during COVID. That's exactly why. For a lot of those folks, they've been able to tamp down that use, go back to work, function well, and there hasn't been consequences. But for a percentage of those folks, they were not able to go back to work. By the time 3 o'clock ran around, they were used to drinking by 3 o'clock in the afternoon. And so when somebody said, come back to the office, they were unable to do that. They couldn't get out of bed. And so we're still dealing with that. We're still dealing with the opioid crisis. The numbers are not as bad as they were in 2016, but they're up there. And to give you a sense as to what I mean by up there, year over year, here in Nassau County, the fatalities are up 35%. And so 35% more folks are back to losing their lives to something that's completely preventable. And understand that overdoses are just the tip of the iceberg in terms of the total impact that untreated addiction has on the family and the very kids that we're talking about. So, the hope is that we can get those gains back. We were making really great progress, but overdoses have increased. Marijuana use, with the legalization of marijuana here in New York State, has increased fairly substantially. So the use of every drug, including alcohol, has skyrocketed during COVID. It's ironic, and this came up before, I think Liette mentioned it. It's ironic that we have school board meetings now being disrupted with adults wanting to have political debates when our kids are dying of overdoses, they're dying of completed suicides. They're dying from school shootings, and we're standing up at school board meetings that are being shut down because we're arguing about masks and things like that. That's a shame, and it leaves me feeling like we're missing the boat. We're losing an entire generation of at-risk kids, while us adults are focused on all the wrong things.
Yeah, I want to discuss, and I guess this is a good segue, in terms of the treatment of mental health in general, and particular other places. New York City Mayor Eric Adams recently estimated that 40% of the prisoners in Rikers Island suffered from mental illness. And in recent days, we've had stories that it seems it's in the news every other day. A woman was pushed to her death in New York City by somebody who was identified as having mental health problems. We had somebody take hostages at a synagogue in Texas, and we hear again this is mental health issues. How are we treating just mental health in general? I mean, it kind of stares you in the face, and you see the school shootings, you see all these people. It's always they had a mental health problem. How are there so many people that are out there that are basically not being identified or properly treated?
A great question, Steve. I'm thinking about everything that Jeff and Andy just talked about. I have so many thoughts about all of that. But I think that, well, let me just say, one of the issues is that a lot of people with mental illness are treated like criminals. That's the basis of a lot of the issues. And it was recently discussed in an article by the CEO of NAMI, which is National Alliance for Mental Illness. He wrote an op-ed, which was really great, saying that really what we need, people in crisis need help, not handcuffs. And a lot of times when there is a mental health crisis, the first thing people do is call 911 because they don't know what else to do. And law enforcement has acknowledged that they're not trained sufficiently to deal with mental illness. So they come, and despite the fact that they're not trained, about 10% of their budget and about 5% of their staff goes to treating mental health illnesses. So one of the things that's happening, which is pretty amazing, is in July of 2022, there's going to be a number designated as 988 rather than 911, specifically for people who are suffering from a mental health crisis. And I think the benefit of that is that rather than having, what did you say, 40% of people in prison have mental health illness, that these people will be able to contact a number 988, where there's going to be mental health specialists manning it 24/7, mobile crisis units. In fact, he's asking for $100 million from, the Congress, so that we can get people trained to do this and get these mobile health units. It will reduce the number of people in jail having mental health illness and get them more the help that they need. They're not getting the help that they need, right? And one can argue why, with all the things we talked about in terms of the lack of insurance parity, which is something that I'm very passionate about. And I wrote a piece in Fortune about a year ago saying the reason that people are not getting help, as Jeff and Andy were talking about earlier, is either they can't afford it or there's not enough people to give that kind of help, right? So one of the reasons that we have so many people that are in jail with mental illness and so many people not being given it is because there's a lot of things that have to be done on a government level to help out. We have to make sure, I'm in private practice as well as in the school practice, I never took insurance private practice because they didn't pay mental health workers what they needed to get paid. You cannot sustain a practice with what they wanted to give you. And then I got into the school practice where I'm on a million different panels. I feel so great that I'm able to help people through insurance, right? But then the insurance companies, because of lack of parity, something that they were supposed to have, are coming back and saying, well, you only can get 5 sessions per year. So they're telling the providers how many sessions, Jeff's shaking his head, how many sessions we're allowed to give them. As the professional in mental health, all of us, we know what we need to give, but our hands are tied. So today, a statistic came out that 40% of people who attempt suicide never had any mental health service. That's outrageous. It's not because they don't want it, perhaps, but because they don't know where to get it. Or there's lines like we talked about before and wait, so people can't get it. So what we need is government to step up. We need them to step up and give incentives for people to go into psychiatry and mental health work in general. We need them to pay in a parity way to appropriately the same thing to a psychiatrist and a mental health counselor as they do to a cardiologist or anyone else. And that has to be started. The other big thing that has to happen is we have to keep talking more, like we're doing. This forum is amazing, about mental health, normalizing it, standardizing it, reducing the stigma, offering hope and solutions to people. That's what we try to do at the center, at the school where I am at NYTCOM. And I know that that's what Jeff and Andy try to do with all of their services as well.
Steve, there's two things that I would mention. One is, we are seeing some new models for mental health care. There's one in Suffolk called the Dash Center, which is a crisis stabilization facility that's designed as an alternative to bringing your child or going to the emergency room yourself, which tends to not be a very pleasant or productive experience. And the hope is that they'll open one of those in Nassau County as well with some state funding. And so we are finding some new models of care akin to a walk-in clinic for mental health conditions. The other thing that I think is really important, and it's something that hasn't necessarily hit its stride, when we talk about young people, parents have a huge amount of influence over their kids, but kids have a lot of influence over each other. We haven't yet figured out how to adequately train young people to be mental health ambassadors and to reach out to their friends and support their friends in crisis. One of the biggest dilemmas our high school students face is when they know that a friend is in trouble and they don't want to tell anyone because they're afraid of setting off a chain of events that they'll no longer be able to control. I think training around mental health first aid for our young people is absolutely critical. They become our best ambassadors. And maybe they began going on to TikTok and Instagram and posting things about mental health instead of other things that we view as being less helpful. If you want to reach young people, go to where young people are and deputize young people to be having those conversations in ways that we as adults sometimes can't.
Steve, I'd like to,
Sorry.
if you don't mind, I'd like to comment also on what you had originally raised as a question, using the two illustrations of the woman that was pushed down on the subway track and also the hostage situation in Texas. At the same time, and I think Jeff mentioned it before, that as a result of the pandemic, people have become more open to the issue of mental health and mental illness, that I think it's situations like this that become politicized in the media and just add to the stigma and the discrimination. So at the same time that we have this more open acceptance, we also continue to face, which is part of the division that you talked about in the country before, we continue to face people being stigmatized, which makes it more difficult than, for people to be able to own having a mental health problem as the same as a physical health problem and something you can just ask for help for rather than feel that you have to hide it or just kind of squash it in some way.
We don't have a lot of time left. We have so many more questions. This is such a large topic that touches everything. Policing. I think you touched on it, Leah, in terms of the response. We send police out. What should we, can you expand a little bit more on what we ought to be doing rather than we call police? Should police be trained? Should they be accompanied by somebody who is, should they be trained better in helping people? Should we be having somebody who has a background in assisting people with mental health? Because so often you see police go to a situation, they don't know how to handle it, and then it blows up and something bad happens. So what's the solution to policing?
Well, I think, yeah, that's a great question. I think one of the things that I was focusing on earlier is the whole point of having this 988 number coming out is to make a distinction between someone who's had mental illness and someone who's a criminal. And there's this fallacy that people who have mental illness are aggressive all the time and that they are, dangerous to be around all the time. And many times that's not actually the case. And when the police come, it escalates the situation. If they feel attacked, if they feel that, they're being cornered, it is going to escalate. And then they end up, being taken away in handcuffs. So the 988 number, I think, is a great start to, you have a mental health crisis, then you go to a mental health hotline, not 911 for a criminal situation. Jeff was talking about a DASH program and so on. And I think that's another thing, having these kind of, emergency rooms, if you will, like we have psychiatric emergency rooms, they exist, but separate from the hospital, having like an urgent care for behavioral health would be a great thing. Jeff also mentioned behavioral health first aid. We implemented in our school program with the medical students and now going to the undergrads as well, a behavioral health first aid program. And essentially what I liken it to is you're familiar with CPR training, and knowing how to help people like that. It's a behavioral health first aid. It's CPR for a mental health crisis. And it trains people to identify signs and symptoms of when somebody might be in trouble. We do it for the faculty, the staff, and the students, and it's something that I think should be done in local schools, so that students know how to help each other, that they don't feel like they're reporting, or getting someone in trouble, but rather getting them help. So as far as policing is concerned, yes, I think that there has been an effort already. I'm not an expert in it, but I think there's an effort already that police officers do get training in trying to understand how to de-escalate a situation when it involves somebody, with a mental illness. But they have a lot on their hands with doing everything else they need to do. I think that we do have to have a team, which is what the whole 988 number has behind it, of trained individuals who know, and people who know how to follow up the following day and say, how did you do? Did you get to a place where you needed to go? To be able to tell them on a local level, this is the place that you can take your child or your mother or whatever's going on. And take it out of the hands of the police, and more into people who are trained.
We're in danger of running over my self-imposed deadline. But I have one question that I have to ask, which is the homeless. And the gentleman who pushed the woman in New York was a homeless person. How much of that problem, I understand there are economics, there's affordability of homes, there's people being evicted, which is another crisis that's looming before us. But how much of the homeless problem is a mental health issue? I'll let anyone here is free to, Andy or Liad or Jeff, you can each chime in if you'd like.
I would say lots. Look, when you look at the population and the notion that you have to be not using drugs, you have to be stable in order to get housing just doesn't make any sense. And so a lot of that crisis relates directly to our mental health crisis, and adequately getting those folks services would help solve at least part of the problem, not the entire problem, but would certainly go a long way.
All right. Well, I'd like to, let me give one final question, which is, if someone that you know is having a mental health issue that you're aware of, what should you do? If someone in your home, somebody, a friend or somebody should do, where should I reach out?
Well, I haven't worked there for the last 6 months, but I would certainly refer them to North Shore Child and Family Guidance Center if it's a child from birth up to 18 years old. And there's a triage and emergency program in which they're seen within 24 to 48 hours. So any emergency situation will be responded to very quickly. 516-626-1971.
Jeff?
Yeah, so look, FCA provides some mental health services as well. Our website is fcali.org. But here's the other thing I would add. If you believe that somebody might be struggling, you don't have to be an expert in mental health in order to approach them and simply ask, are you okay? Right. And so that goes a long way. And for a lot of people, that opens the door to a much larger conversation. So if you take nothing else out of tonight, the ability to tap another person on the shoulder and say, hey, are you doing okay? Goes a long way and might open the door to care, whether it be at North Shore Family Guidance, at FCA, or at one of the other organizations.
Leon, your recommendation?
My recommendation is that if somebody in your family or somebody that you're working with that you're concerned about, ask them. Like Jeff just said, don't be afraid to ask them. A lot of people feel awkward approaching the person they may insult them. A lot of times people are waiting for help. They're waiting for someone to say, are you okay? And I would ask them if they're okay and if they need any help. And the most important thing is to go ahead and ask that question, which is so hard for people to ask. Are you thinking of hurting yourself? And if the answer is yes, which people will tell you, take them immediately to an emergency room. That is like a medical emergency. If you ask someone you're having chest pain, you go right to the emergency room, you do the same thing. If people are interested locally, people listening to this webcast right now, you can look at the NYIT resource. We have a resource list on the NYT.com resource, New York Institute of Technology, College of Osteopathic Medicine, with local and national resources for many, many things, including depression, anxiety, suicide, substance abuse. But know that you're not alone and that help is out there. That's the most important thing.
Thank you. Thank you very much. I would like to thank Dr. Leon Jarkin, Andy Malikoff, and Dr. Jeffrey Reynolds for this very insightful and needed conversation, as well as those who attended this evening. I would also like to thank again Northwell Health for sponsoring this evening's discussion and others. For those who were unable to watch today, a recording of our discussion can be found on Blank Slate Media's website, theislandnow.com, our Facebook page, and our YouTube channel. A story about this evening's event will appear in the 6 Blank Slate Media newspapers. Our next town hall will be a very special event to be held on Thursday, February 17th, featuring Jonathan Greenblatt, the CEO of the Anti-Defamation League and author of It Could Happen Here: Why America is Tipping from Hate to the Unthinkable and How We Can Stop It. I don't think you want to miss the discussion. Sounds like a discussion that the three of you might want to join, but we certainly hope that everyone will tune in for that. And again, with that, I want to thank our guests for a very insightful, educating discussion. Thank you very much. And thank you for those who attended as well.
Thank you.
Thank you, Steve.
Thank you.